Assalamu alaikum, Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the maxilla for implant placement. Now, the anterior maxilla and the posterior upper right maxilla, the upper right area, we still have slight bone, but the upper left segment of the maxilla, especially between the lateral incisor and the second premolar, we've got very thin, fine bone where implant placement is going to be absolutely impossible until and unless bone augmentation is not done. So starting with the upper right posterior segment, this is the first molar region. We've got a short ridge, approximately 5 millimeters of width with just 6 millimeters of height. So we will need a crestal sinus lift approach. This is the region of the fourth. So we've got very good bone here, approximately 6.5 width with 8.5 length. This is the region where we have a BDR, and hence this is the upper right 5 region, 7.8 of width with 11 millimeters of height. So implant placement here is definitely possible. This is the upper right 4. This is the upper right 3. We would highly advise to have this tooth saved because this has no periapical radiolucencies. This is our upper right lateral incisor, again thin knife edge, so implant placement can only happen here. 4 millimeters of ridge width with 8 millimeters of height, so we placed the implant here much deeper. This is the upper right central incisor, again slightly good ridge here, 4.7 of width with 11 millimeters of height. Moving to the canine region, so again no bone, absolutely thin ridge bone. So we've placed in a very thin implant, which you will see later on. Again, no bone in the canine, the premolar region, very thin ridge. We've got some bone in the first premolar region, so we've placed an implant here. And we've got to do a sinus lift in the upper left segment, but please bear in mind that we've got sinusitis here. The ridge width approximately is 6.5 mm and just 5 millimeters, so there will be a need for a sinus lift here. So these are all the measurements. So this is how the implants look. We've placed in the areas where we absolutely thought we could place, but even then we would highly advise that despite these implants being in the center of the ridge and with the maximum bone support, bone augmentation around these implants is absolutely necessary because the bone quality here is also D3. So hence bone augmentation is essential prior to or along with the implant placement. Thank you very much.